Okay, good afternoon. I'm Dr. Joel Roos, the Vice President of International Accreditation, Quality Improvement, and Patient Safety for the Joint Commission International. It's a privilege to be standing here today. I'm sure many of you are both tired and excited as we can finally travel and interact with colleagues in an open setting. Before we begin, just a little bit about me. As an emergency physician, I've held a variety of roles and led the largest U.S. Navy hospital. That means I've been on the receiving end of many Joint Commission Accreditation survey, so I appreciate the work that is involved. I also have participated and led efforts to transform organizations towards high reliability during my 30-plus years with the U.S. Navy and Veterans Health Administration. This IHS conference is a perfect example of the disruptive innovation catalyzed by the COVID pandemic. The various sessions can be attended in person or remotely via live streaming. This is one of the many adaptations we have observed across the world in various industries. Many of these practices will remain even as the pandemic abates, as they are improvements over the status quo. The Joint Commission International was not immune to the pandemic. We were challenged to innovate in order to continue our operations. During today's session, I'm pleased to share how we at JCI rose to the challenges of COVID and adapted our operations to continue our mission and stay connected with the many healthcare organizations we serve. Although remote operations were not new to us, we previously employed them as an exception rather than the norm. However, this past year, we moved to the remote and hybrid surveys as a standard mode of our service delivery. Like many of the other innovations, these too will remain as the pandemic resolves. Our agenda today will encompass a few topics. I will briefly address the importance of accreditation and discuss how the remote survey compares to the traditional on-site survey. Then you'll hear directly from two of our long-standing clients, Amphia Hospital and Taichung Metro Harbor Hospital, as they share their experiences with the remote survey process. Both organizations have undergone numerous traditional on-site surveys in the past. I've asked each of them to share their organization's perspective on the remote survey without any editing or interference from me. So you will hear what went well and what JCI needs to improve on. In addition, they will both illustrate the remote survey process much better than I will be able to talk about it. And finally, we will take some questions at the end. The decision to pursue and maintain JCI accreditation is no small task. It requires an ongoing commitment of time and resources. The question becomes, why pursue it, much less repeat it every 3 years? If one views JCI accreditation as a simple endpoint, an achievement all its own, then the answer becomes difficult. However, JCI accreditation is not a goal, but rather a necessary step towards the ultimate objective, zero patient harm. We're all concerned with delivering the highest quality and safest health care to our patients, no matter what our roles, clinicians, administrators, or support staff. The epitome of this goal is high reliability and zero patient harm. Unfortunately, the healthcare industry is far from achieving this target. I believe the JCI accreditation process is a necessary step toward the achievement of this lofty goal. Accreditation provides the necessary tools for process improvement and measuring the quality of care. Most importantly, it helps define and embed an organizational culture centered around patient safety and continuous improvement, a foundational step towards zero patient harm. The ongoing cycle of accreditation continues to refine the tools and reinforce the culture, which leads to increased levels of quality and patient safety. Accreditation helps organizations achieve safe and reliable systems. When appropriately used by leadership, accreditation is an effective tool to drive standardization, reduce variation, manage risk, increase quality and safety, all leading to excellence in patient care. I recently had a discussion with a long-term client during a presentation. He questioned me why he should continue with the accreditation process after 6+ cycles of accreditation. He had trouble seeing the benefit. However, when we discussed the hospital's response to the COVID pandemic, he immediately cited that JCI accreditation had prepared the entire organization to deal with the pandemic. Despite the difficulties, they developed policies and procedures to ensure safe, high-quality care in this fluid and challenging environment. Upon reflection, we both realized that JCI accreditation had become integrated into the organizational DNA and was in fact part of them and therefore not immediately apparent. Without these tools and culture, the hospital COVID response would have been much different. That's the value of JCI accreditation. JCI accreditation focuses on a combination of standards compliance and performance measurement. Our standards define requirements based on recognized evidence. We also focus on the measurement of these standards, which assess the performance against the requirements and expectations. The measurements create the baseline for continuous improvement and enables the organization to evaluate the impact and risk if they're not fully compliant with these standards. In the interest of time, I won't go into the details of our standards, but I'll mention that they are broadly divided into two categories. The first, with patient-centered standards, includes patient care, access to care, and continuity of care. Medication management and surgical care are other topics included as well. The organizational management standards involve governance and leadership, quality and patient safety, facility management and safety, as well as staff qualification and education, among other items. I would briefly like to highlight the 5 key elements of every JCI survey. The first is tracers, in which our surveyors engage with staff and patients to validate how the standards are compliant in practice. This involves evaluating a process from the beginning to the end, usually by following a patient's journey of care. During each tracer, the team will develop an understanding of the workflow through discovery and active engagement with your staff, followed by sharing of best practices. The second element is the policy and document review, which is a process to evaluate the various hospital policies and procedures. The tracer process will assess if these policies are consistently observed throughout the organization. In an on-site review, our surveyors are given large binders of printed material, but for remote surveys, we developed a secure portal where the organization can upload their documents so the surveyors can review these prior to the actual start of the survey. This is one innovation that will not change after the pandemic. The third is formal sessions. And these are set up to meet with the various teams to review different practices and gain firsthand knowledge of policies, procedures, and practices within the organization. Topics might include medication management, infection prevention and control, and staff qualifications. The fourth element is the environmental tours. This is the walk around of the facility, looking at flow, safety, and the layout of the facility, among other things. This is the first-hand look. And lastly, we conduct morning briefings, as you might have guessed, every morning. And we begin each survey day with these meetings. It's an opportunity for us to meet with the leadership and your staff to review the previous day's activities. We have a chance to tell you a little bit about the things that you do incredibly well, plus your opportunities for improvement based on our observations of the previous day. These also are very popular among the staff, and the remote survey process has actually allowed hospitals to advance the attendance or increase the attendance because they don't have to be in a room. I briefly want to summarize the 3 survey methodologies that we now offer. On-site surveys is our long-standing traditional approach. A team of surveyors visits the organization in person. All work, including the document review, is conducted at the facility. The on-site approach has been used for over 99% of our surveys. Prior to the pandemic, we were unable to send surveyors to a few organizations due to travel or safety limitations, so we occasionally employed the virtual survey. The COVID pandemic forced JCI to quickly improve and implement the virtual survey as our standard process. And actually, at one of the poster sessions here, I actually met a prior leader of the organization that experienced the very first virtual survey in Pakistan. So it was an interesting conversation. The virtual survey, as it may sound, is when the entire survey team is off-site in a remote location, and the survey is conducted entirely via video conferencing. We generally use Zoom or Microsoft Teams with a variety of hardware, whether it's a laptop, cell phones, iPads, or networked video cameras. I personally prefer the term remote survey versus virtual, but you'll hear them used interchangeably. And finally is the hybrid survey, which is really a combination of the two, where we have a split team of surveyors, some on site and some remote. I personally feel this will actually become far more popular in the future, as it allows JCI to apply more specialized skills that are not required for an entire survey, thus saving time and travel costs for the organizations. For example, using a pathologist for the laboratory portion of an evaluation, which may encompass half a day of a long survey. The other advantage is it will allow me to hire experts that might not be able to travel due to physical limitations, which is a real benefit to all involved. But no matter which survey methodology is employed, JCI is able to provide an organization with a flexible approach to accreditation. Be sure to note that the processes are unchanged, the standards remain the same, and the rigor maintained, ensuring the value of the JCI seal. Finally, this slide highlights a comparison between the traditional survey and the virtual surveys. And in reality, there's not much difference. On-site and remote tracing is the same. The only difference is rather than everyone in a room or following a patient around a hospital, they're following a video camera. The biggest difference really is the documentation. As you can see, the binders of information are condensed into electronic submission of PDF documents. And in the future, I would actually like to be able to incorporate language translation as part of the process so that organizations can keep it in the local language and we'll translate for you. That's as the IT aspects improve. And then tours and other meetings done either remotely or via Zoom. As you can see, the same people are attending, they're just attending differently. So, to summarize, the COVID pandemic catalyzed JCI to adapt its processes to a new and difficult world. Through the use of technology, we were able to ensure the survey process and subsequent accreditations were not compromised. The only thing that changed was the technology, not the standards, the methods, the surveyors, or the rigor. We have not changed or compromised the quality of the JCI Gold Seal. In a moment, you will hear the first-hand experience of two organizations that have undergone both on-site and virtual surveys. But I'd like to close with the following quote from a CEO of one of our Hong Kong clients. When I heard we were having a virtual survey, I thought it was going to be like an open book exam. I realized in the end that the virtual survey was actually very rigorous, comprehensive, and great for our institution. That's been my experience with open book tests as well. They're generally harder than the closed book. I would now like to introduce Linda Klauwans Verhoeven, JCI Program Manager at Amphia Hospital in the Netherlands. A little bit about Linda. Linda is the JCI Program Manager for Amphia Hospital, one of the largest non-academic top clinical hospitals in the Netherlands. In her role, Linda is responsible for guiding the organization towards the maintenance of JCI accreditation. She also holds the role of Chief Nurse Information Officer. Prior to this, Linda has been a team manager of the intensive care unit and an ICU nurse. Linda earned a Master's of Science in Healthcare Management from TIAS University in Utrecht. In her free time, Linda likes to cook and have dinner with friends, exercise, and enjoy family activities.
Thank you, Joe, for my introduction. I hereby will share my experience with our remote JCI survey in Amphia Hospital in the Netherlands. I'm planning to tell you something about our preparations for the survey, the initial survey, and the lessons we've learned. Oh, let's see how this works. Yeah. So Amphia Hospital, as Joel already said, is one of the largest teaching hospitals in the Netherlands. We have a good collaboration with Erasmus University in Rotterdam. The Dutch healthcare system is of a very high quality. As you can see in this recent publication of the Commonwealth Fund from this year, we score second after Norway of the following topics: access to care, care processes, administrative efficiency, equity, and healthcare outcomes. However, we do face a lot of other challenges in our country. We have aging population, we have a lot more complex care is needed, and we have a national shortage in healthcare professionals. So this gives us the opportunity to care for our healthcare professionals of their well-being. And since a few years, there's been an upcoming resistance to administrative burden and to account for everything, such as JCI accreditations. So this makes it a little bit difficult in preparations to this survey. I will come back to this later. Amphia Hospital is one of the largest hospitals, as I already mentioned. Here you can see a picture of our new building in which we moved into 2 years ago. We have 551 single bedrooms in our new building, and the other 2 locations are outpatient clinics. Here are some of our key figures. We see a lot of new patients every year. We are a financially healthy hospital, and we provide jobs for over 5,000 people, of which almost 700 residents and nurses in training. Well, in preparation for our reaccreditation, COVID hit us. This is a newspaper article which says that together with our neighbor hospital, we admitted almost 4,000 patients with COVID disease, and we lost 584 lives during this COVID crisis. So in this time, it's no time for a reaccreditation of JCI, so we had to postpone our survey. Fortunately, we were able to reschedule our survey between the second and the third COVID wave. So this helps us, but we were not able to expect any foreign guests in our hospital, so the survey needed to be fully virtual. We saw 5 surveyors for 5 days, and we also had 4 translators virtually present due to the fact that we could not expect any guests in our hospital. The translators were necessary so our healthcare professionals can speak in their own language. But we had to be creative because we were a bit anxious about a full virtual survey. We were wondering, can we do this? And how do we prepare for this? So we did a Zoom test with the JCI team where we practiced with speaking through Zoom. We bought some equipment. We purchased 10 iPads for all tracers in 3 locations. We used a Zoom app on our telephone in case the Wi-Fi fell down. And we used microphones and meetups for sit-down sessions. We also had 2 ICT employees present for support. What was very handy was that JCI shared 1 Zoom link a day on which all sessions and tracers were executed. We planned colleagues from our quality and safety department next to physicians and colleagues from our facility department to guide the auditors throughout the organization. And with these iPads, they saw a lot of our departments and wards. They visited our acute care, they've been to the OR, the ER, our day center, and they visited general wards, an outpatient clinic, day surgery, and also diagnostics, central sterilization, our laboratory pathology. They almost saw the whole hospital, and that in 3 locations. We also had sit-down sessions, as Joel mentioned earlier. This was a talk with our pharmacist. We also had other talks about our quality measurements, about our supply chain. We had talks with different committees, like our pain committee and our vulnerary elderly committee. And we had a lot of sessions about the HR files and the patient's records. Here you can see some pictures. The above one is a visit to the general ward, where they interview a nurse about care pathways. The one below is a visit to the trauma room, where the team manager is explaining how they care for a trauma patient. And the last picture is about a visit to the outpatient clinic, our breast center. Here are some pictures of our sit-down session with medical files. We talked about research and training, and the other one is a visit to our ICU. And this is a session with our infection prevention team where we talked about risk management and outbreak management. And the iPad even made it into the OR. One of our surveyors was from Belgium, and he met 3 fellow citizens of Belgium on the operating table, so they had a nice chat in their own language. Oh, here's the iPad, in case you didn't see it. So as you can see on the faces of our board members, we passed the survey with flying colors. We received the certificate from JCI, and according to the SAFER matrix that JCI uses to feedback the findings, you can see that there weren't any widespread or high-risk findings during the week. So this is a huge compliment to our healthcare professionals in these hard times of COVID as well. But celebrations were different than 3 years ago. This was a picture of our initial accreditation, and there you can see that we can come along with a whole group of people celebrating. But by sending the Zoom link with the organization, around 100 computers logged in every day to watch with us the daily briefings and the closing sessions. So we did not expect this, but the people were very involved during this week, despite it was a virtual survey. There were lessons learned. Our healthcare professionals, especially our nurses, they felt embarrassed to talk to the iPad, so we had a little bit of practice done, and we usually found a quiet space to start the conversation, and then it worked well. Preparation is necessary for sit-down sessions for some of them, because when you show the closed medical records or the employee files, you can only share one screen in Zoom, so these sessions take more time. It's good to know in advance. But overall, positive points. By forwarding the Zoom link, people were engaged, as I mentioned. We use a translation channel by Zoom. That was very handy for the interpreters. Our surveyors were very patient. They saw a lot of ceilings with the iPad, but they stayed very patient throughout the whole week. So that was very positive. And as said earlier, they have seen a lot. This survey, we really feel it was a full-fledged audit, and it wasn't easier than our initial survey. It was also very efficient because there wasn't any travel time because we used so many iPads. We could log in between the sessions at once. It's also a bit cheaper to do a virtual survey.
Yeah, yes, it is.
So back to our initial concern that our healthcare professionals do not want to account for everything and have trouble with the administrative burden. I asked this question the Monday after the survey. After the past JCI week, what is your take on JCI accreditations in Amphia? And 1,002 physicians and nurses answered this question, and a little bit outpatient staff. And they answered this question that 52% have a good feeling about hospital-wide accreditation. But it has to be appropriate for Dutch healthcare. The reason that this score so high is because in the Netherlands we do want to do everything ourselves. So why does this American company has to come do it for us? But 31% thought JCI was exactly what we needed. So overall we scored 83% of people who were very enthusiastic about hospital-wide accreditations. And it was really a lot more than we expected. So we talked this over with our board, and we reviewed our results, and we decided to stay with JCI to continue to improve the quality of our healthcare altogether. So this was my talk. Before I hand it over, are there any questions?
We're going to take them. We'll have a session at the end for questions as well. So.
Oh, yeah, I'm sorry.
No, that's okay. So. Is this mic on? Okay. So thank you very much for that great presentation. Your pictures spoke literally 1,000 words over what I could even begin to present. Now I'm pleased to introduce you to Dr. Hong-Yi Xu, Deputy Superintendent at Tung's Taichung Metro Harbor Hospital in Taiwan. Unfortunately, Dr. Xu was unable to travel to Spain, and he is attending this conference remotely like many others. He pre-recorded his presentation, which I will share with you now. Following this video presentation, we will open up for any questions. A little bit about Dr. Xu. Dr. Xu graduated from the Department of Medicine of the National Yangming University. Attracted by the mysteries of the brain, he continued to receive neurology training and became a neurology specialist. From 1997 to 2009, during his service at TCVGH, he assisted in the establishment of the Stroke Center and served as the director. He continued to conduct research on cerebrovascular disease and ultrasound diagnosis, obtaining a PhD and becoming an associate professor in the process. Because of career planning and in order to get more experience, he transferred to Tung's Taichung Metro Harbor Hospital in 2009. Soon after he came to Tung's Hospital, he served as the Deputy Superintendent and supervised the Quality Management Center, and as well as the accreditation of hospital, including the JCI accreditation process. Dr. Hsu is currently the Deputy Superintendent, Director of the Board of Tongues Hospital, also the Director of the Taiwan Stroke Society, and the Professor accredited by the Ministry of Education of Taiwan. Dr. Hsu, it's all yours.
因为疫情的关系，医疗产业改变了原本既有的模式形态，医院也重新检视并更新作业方式，运用科技方式来跨越距并减少不必要的接触。同中文医院一直致力医疗品质的提升，并希望医疗服务品质与世界同步。2020年更不受疫情影响，连续5天采用视讯方式，完成第5度 JCI 国际医疗品质认证。
这一次我们接下来的评鉴所受到疫情影响，可以说是全国第一个采用视讯评鉴，也是我们全国首创。我们没有任何的参考经验为了品质，这过程中遇到很多个挑战，从视讯的品质、回音、lag、手机的晃动、书面的资料的方向搞错了，全部都会困扰到我们。但是各单位脑力激荡，确实演练，克服重重关卡。展望未来呢？视讯拉近了我们的全球距离，视讯的评鉴也是个趋势。我们医院做了全国最好的模范，透过JCI委员的指导，提升了我们的医疗品质，确保病人安全。
这一次是以视讯的方式来完成整个评鉴，透过这个视讯评鉴，好像让委员能够亲身到我们的现场来看我们所有的环境。所以其实那一天在评鉴的时候，在急诊部委员也实际看了我们的防疫的整个防疫的动线也好啊，解伤分类，还有对一些急重症的处置，甚至让我印象深刻的是，连我们急诊部洗手槽的下面的空间也打开给委员看。所以事实上，透过整个视讯的评鉴，还是能够让委员好像能够亲身来到急诊部一样来完成整个评鉴。所以其实这个也让我蛮印象深刻的，也让我再次的赞叹，其实这个视讯也好，还有现在的5G 也好，整个在影像上的传输的流畅度也好，还有整个过程，整个是让人家觉得还蛮惊艳的。
那我个人所做的事情就是在研发部分，另外他也发现我们有参加国际的临床试验，所以他也针对临床试验提到病人就是受试者的保护。那我们也根据他的问题一一的回答呢，所以委员说，奇怪，你所回答的怎么跟我们的标准答案是一字不漏的？我们说，其实我们就是按照 JCI 还有受试者的保护，还有 JCP 这种整个 IRB 的一个制定的 SOP 的流程，还有保护都按照这个来做的，所以跟他们认为的一个标准的流程是完全一样的。所以他们给我们非常好的评价。
我们是第一家台湾接受这样全视讯的评鉴。那我们这次为了这个全视讯的评鉴，我们做了很多模拟，包括我们的视讯车到各单位的时候，怎么样在第一时间把委员可能会要看的，包括电脑上的 SOP， 包括我们的意识系统，包括我们的护理记录，还有我们的一些单张，包括卫教记录等等，可以很快的透过这个视讯的方式传到几千公里外委员的地方。大家也可以感受到，从 COVID-19 从去年一整年这样的一个蔓延，包括卫福部的政策，我们相信未来这种全视讯的评鉴应该是变成常态，甚至变成主流。
以往的话都是委员到现场来直接参观嘛，然后有什么问题直接指导。然后这次是因为透过视讯的方式来跟我们做说明的时候，我们就必须去练习说怎么去面对镜头，然后去跟委员好好去做这个说明这个部分，才有办法去做得更完美。然后这次我也觉得说视讯最大的差别就是说，对我们来讲会觉得它的看的面向会更广，然后看得更细节一点。所以的话，其实在针对我们在临床上，其实对我们这帮助是蛮大的。
我觉得这次的评鉴还蛮特别，就是因为它是采用视讯评鉴嘛，然后我们一开始都觉得，视讯好像什么事情都会看不到这样子，就没想到委员就像真的诊一样，他可以从每个地方这样子做 环景的方式去看，然后甚至说在我们生产室里面的时候啊，他进去看，我们以为他可以看我们的那个登记表、温湿度啊，还有那个空调压力，就没想到他是直接测试我们的温湿度跟空调压力。我觉得整个感觉起来那种临场感非常的实际，这样子。
我觉得之前Jci委员来的时候啊，来这边停留的时间都没有这一次那么久。之前会有临床组、护理组、医疗组来，可是待的时间都大概5分钟到15分钟，都不超过半小时。这一次可能是视讯评鉴的关系，然后在这里的时间，他看的点啊还看蛮多的。像到检查室里面的时候，他就要那个我们的镜头360度绕一圈给他看。
在这一次的法评经验当中，我们认为除了法评的方式不同之外，其实委员也会因为采用视讯的法评，所以法评的内容其实也会做调整。例如过往很少查核所谓的疏散计划，可是这一次特别要求各部门要有疏散计划，这也是各部门在过往没有注意过的条文。所以我们认为，透过不同方式的法评，让医院可以有更大的成长与进步。
经由Jci评鉴可以学习，从国际的视野来观看整个医院的整体，无论是环境、卫生、消防等设施设备，都可以不同的角度来检视。另外，委员看得很仔细，而且愿意分享各种的经验，让我们受益良多。这次委员虽然说医院的软硬体设备都很好，但我们可从委员的交谈中知道自己不足及改善的空间，相信医院会越来越好。
好，首先谢谢我们全院的同仁们，你们太认真了哈！今年看到我们的视讯评鉴啊，尤其是非常感激我们资讯室花了很多心血哈，设计的非常美丽而且强壮的视讯行动车哈，而且在我们全院的同仁哈合作之下，快速的引导我们的评鉴委员看想看的东西，而且我在这次评鉴感觉出来是我们的医院的员工非常团结哈，又在视讯在反映意见的时候非常快速哈。那我相信我们这次的评鉴通过是完全是靠我们的实力。
这一次医院医疗视讯评鉴，第一次感受到4G、5G 的威力，那可以让世界各地专业的医疗人员在同一个时间，那及时的针对本院各项临床、医疗、护理，那以及各个职类，那还有各个面向，那给予最及时以及正确的指导。那也感谢同医院员工这段时间大家的努力，让评鉴顺利完成。
那我们这5次的评鉴里面，我觉得大家都越来越成长，也越来越知道就是怎么样是对病人好，怎么样是站在一个安全的观念跟理念的情况下，去为病人做付出，给病人更多更好的一个选择。每一次都有每一次的挑战，那每一次的挑战中，其实同院都不断的在蜕变，像这一次的视讯评鉴一样，在蜕变中，我们都看到更新、更年轻、更活泼的一个同医院。那也因为这样的同院一直有创新的点子，希望可以跟上世界的脚步，希望可以跟上整个国际的一个轨道。那我以身为同院的一份子为荣。
我想这次的视讯评鉴对我们所有人来讲都是一个全新的体验哦。透过视讯的镜头，我们尝试着可以从委员的角度来看看我们委员的表现，包括你讲话的态度，你要看镜头的什么地方，怎么去表达一个自己的想法，做一个最完整的呈现，这些都是一个很好的学习。那在这个过程当中，我们也发现，其实我们每一个员工都是最佳的男主角跟最佳的女主角。那在这里谢谢大家。
那我们透过这次评鉴，其实大家可以知道说，我们除了评鉴视讯影像之外，其实我们也适度的结合了一些院内的资讯的系统跟流程。那其实可以提升这些教学或者是会议，甚至一些医疗诊疗上的一些便利性，让这些病人可能他不需要这么长途跋涉到医院来，他有办法做治疗，或者是才有办法评估。在家里可能拿个手机或者是很简单的设备，透过我们医疗的系统的一些辅助跟协助，可以很快速跟方便的让病人达到就医的一个目的。
透过镜头与位在美国、澳洲的4名医疗专业委员对谈沟通，并一同检视医院的医疗服务、感控安全与 临床服务等等，经过5天的沿线视讯，来检视医院各个重点区域，交流建议。评鉴结束后 ，JCI 美国总部核发证书，这是同院第5度获得这项国际肯定。
So, Dr. Xu, yes, thank you so much to you and your team for this wonderful presentation. For those that are watching, I have to share a little bit of a story. This is actually the second video they've done. The first video was we learned about after they underwent their accreditation, and our staff immediately fell in love with it. Unfortunately, our lawyers didn't. We couldn't use it for anything, but that's a different story. But the original video, which was really about the accreditation, it didn't have photo releases and all things like that the lawyers like. It actually served as the inspiration for this presentation. And we went back and asked the team at Tongues if they would do another video to talk about this along with Linda's team. And clearly we have 2 very high-performing hospitals talking honestly about their experiences, both the good and the bad. And I could not ask for more, and I'm very appreciative. Dr. Xu, I hope to be able to come to Taiwan and thank you personally once the pandemic improves. I think I'll get to Amsterdam or Netherlands far sooner. So with that, we're now open for questions if there are any. I don't see any on the chat box, but please.
Thank you very much. I'm Rabi Laqani from Surgical Hospital Cairo. And by the way, it's re-accredited by JCI in 2020, so remotely also through video. Thank you. Through video, and we have passed all these steps for the preparation, pre and post. And my question, I have 2 questions. The first question, post-COVID, what you are planning for? Are you going to adopt the virtual survey as an option for the survey plus on-site survey? This is the first. The second question is, are you going to modify the way of the virtual survey itself, if you are adopting it to include, I don't know, maybe due to some countries like, for example, I will say like Egypt, we have a little problem for the internet connections. So are you going to make, for example, a plan to extend the survey for 1 more day or whatever according to the situation, or you are just leaving this decision for the hand of the team leader? Or are you going to adopt another way, I don't know, for the survey? So are you going to keep the virtual survey as it is, or you have plans?
So,
thank you.
So first of all, great question and thank you. And you sound like my surveyors because they keep asking, are we going to keep them? And I'll be honest, the surveyors do not like the virtual survey for a number of reasons. And I don't blame them, by the way. As a leader of an organization, you have to listen to your staff and work through the issues. But the first one being is that, about a third of our surveyors or so are based in the U.S., and the rest are all over the world. So if we're using U.S. surveyors in Cairo, for example, they may be up in the middle of the night doing the survey in local time. And so I can understand, unless you like working night shifts, that's not, the time difference is difficult. But I think the real issue is that many of our surveyors really enjoy visiting our clients, and I don't blame them. I mean, it's a combination of the travel to exotic places like Cairo or the Netherlands or anywhere else around the world. It's the interpersonal touch that we are, frankly, all came to this conference for. So those are the hard parts that we have to deal with, which is what the surveyors want. My personal view is, and what I tell them is, all 3 of these surveys are here to stay. The on-site, the completely virtual, and I really think the hybrid is really going to be the long-term combination of both. And it's going to be really up to what our clients want. I mean, because to be, as Linda mentioned before, it is cheaper for a virtual or remote survey because you're not paying the travel costs of the team to come through. So my plan is, as I tell everyone, we have multiple tools in our toolbox, and depending on what we're building, we'll choose the right tool. That doesn't mean that they're perfect right now in the current iteration. I mean, a lot of this, like everything else in COVID, has been developed and as we go along. So there are improvements to be made. The IT piece is clearly one of them, and that's one of the areas whether needs further exploration. Whether we're using the portable 4G. The advent of 4G makes this easier, assuming they're 4G cellular networks that we can provide. I'll also give away one of the things we're experimenting with, and we're just starting down that road, is using the Microsoft HoloLens, which is a remote video device which allows two-way communication, essentially a computer with glasses. And can we either equip a surveyor with it or send it ahead to a hospital that'd like to conduct a remote survey that way? So we're looking to expand how we do this and do it better, and what kind of improvements and modernization can we do. And clearly addressing the IT issue is a big one. Is that? You're quite welcome. It's a great question, and my staff asks me all the time. I think they know the answer now, but I think it's like a parent. They keep asking it again, hoping the answer is going to change. Other questions? I have trouble. Okay, I have trouble seeing because the light is literally straight in my eyes.
My name is Anne-Laurence Lacroix, and I work for the International Hospital Federation. And I was wondering about one of the response to your survey in the Netherlands about the need for contextualization. And I was wondering, how do you respond to this need for contextualization regarding the universal coverage of the survey? Thank you.
Oh, a great question, and I think so. I actually agree with that sentiment. And I've been at JCI for a year, so I'm the new guy who can come in and change things or break things depending on how you view them. But my view is that the standards are universally applicable. It's how they're applied and how they're interpreted in a local setting. There may be some variability. And actually, I'm going to use the Netherlands as an example of where we made a change as we worked with the Hospital Association. And unfortunately, it says just a lot about U.S. society as well. But one of our surveyors approached the concept of child abduction in the Netherlands and wanted to see, when they went to a survey, of where's your child abduction plan? How do you handle that sort of thing? And the hospital rightly said, we don't have one. And the reason is there's no child abductions occurring in the Netherlands. And if you go back over 10 years, they actually produced 10 years worth of statistics that demonstrated, no, it doesn't happen.
28 years.
20, okay, well, I remember 10, but, but unfortunately it happens in the US. And I can't tell you when I was running a hospital how often we practiced code pink drills when a threatened abduction occurred out of the pediatric unit and the like. However, that's really not what the standard says and what its intent is. The standard intent, and I have my director of standards here, is really, do you have policies in place to protect vulnerable populations, not child abductions? For example, and we asked, ultimately when we went back to Netherlands with these questions, was, do you have policies in place, for example, children going through a divorce, for custody issues? That is getting to be fairly more universal. It's not limited to the U.S. Or do you have policies to protect elderly? That's also a vulnerable population. And the answer is yes, and they can suddenly produce the policies and procedures associated with that. So I really think that's an example of how you apply a universal standard to a local situation, and we need to put more of what we do in context. It's very difficult because while some things are universal around the world, not everything is, and so how do you develop that? And that takes, frankly, listening to our clients as well as writing standards. Other questions? All right. Well, I think we're the only thing between the award ceremony or dinner, depending on what your plans are. So I think we'll stop here. Thank you for your attendance. Thank you for your questions, and I'm available for questions afterwards as well as is Linda.